Catherine Coughlin, and today we'll be discussing the pros and cons of gift giving for practitioners of applied behavior analysis. A gift, which may also be known as a present, can be something material and or physical, wrapped or unwrapped, something offered in a formal or informal manner, but acknowledged through a ceremony or event. However, the definition of gifts may be considered more broad than presents, which includes all aspects of social transactions, non-tangible items like ideas, in addition to tangible objects. These types of gifts are held to symbolize the relationship between the giver and the recipient. According to Behavior Analyst Certification Board Professional and Ethical Compliance Code for Behavior Analysts, Section 1.06, Part D, giving or receiving gifts from clients is forbidden, as it insinuates a multiple relationship. The members of our group that will be discussing the debate are Tiffany as our pro-stater, Caitlin as our con-stater, myself as a mediator and pro-provider, Jacqueline in the role of pro-attacker, and Stephanie as the pro-prover, and Mary as the con-attacker. I am now going to hand it over to Tiffany to discuss the pro-gift giving side.
Thank you, Catherine. I am Tiffany Lewandowski, and I will be the pro-stater for today's. It is the belief of our group that the current BACB ethical policy regarding gift giving is too strict and unrealistic. Therefore, throughout our debate, our group will discuss several reasons why we believe the gift giving policy should be updated to reflect a more realistic policy. The new suggested policy would be more lenient to simple gestures of kindness and small gifts that are more of an obligatory exchange rather than a gift for services rendered. Our first point is how gift giving can provide the client an opportunity to express their appreciation of the caregiver for everything they have done in the betterment of the client. Second, gift giving is an encouraged practice for many cultures around the world, as it contributes to the relationships between staff and client. Our third point is how gift giving creates a gesture of kindness, which creates a positive attitude between all parties. Fourth, a small gesture can help both parties celebrate the client's successes and milestones. Our fifth point describes how a small gift makes the therapist feel appreciated, and the gift symbolizes the client's feelings of a job well done. And our final point is how gift giving can help build strong connections and maintain healthy boundaries between the client and the therapist.
We are now going to show a brief clip from Parks and Recreation to demonstrate a gift-giving exchange and how it can be less than ideal.
This is a gold-plated replica of the gun Hugo Chavez used in the 1992 Socialist Revolution. It is a gift.
This gun truly symbolizes the blossoming peace between our two nations. A key aspect to diplomacy is gift giving. The gift has to be nice enough to honor and respect the guest, but not so nice that it shames him. Plus, it needs to represent a local culture. And I found the perfect thing. A bottle of high fructose corn syrup made right here in Pawnee's own Sweetums factory. Sweetums, if you can't beat them, Sweetums, since 1891. And 8.5 dozen rubber baby bottle nipples. Also made here in Pawnee. Kernskins rubber nipples. Tastes like a real thing.
Jason, we too are pleased to end your dirty alleyway.
Thanks, Tiffany. I am Caitlin Schaefer, and I will be the con-stater for this debate. The video we just showed provides an example of how gift giving can sometimes be a misunderstood gesture. Our side believes that behavior analysts must not accept gifts for many reasons. By accepting a gift, a multiple relationship can be created, which can have many negative effects for the parties involved. It can blur the lines of professionalism between the behavior analyst and the client, and lead to a slippery slope towards other violations. Also, by giving or accepting gifts, a change in power dynamic may occur. This can create issues when difficult conversations need to be had, which in turn could pull away from practicing with the client's best interest in mind, for fear of being strict with the client or family when a problem arises. Another potential harmful effect of allowing gift exchanges between client and practitioner is that those who do not participate may feel that favoritism is taking place or pressure to give a gift to a BCBA. The same can occur for a BCBA receiving a gift. They may feel a sense of obligation to reciprocate a gift to the family or feel unsure about the motivation for the gift.
Thank you, Caitlin. I'm now going to talk about the research backing up our claims. Tiffany mentioned earlier that gift giving provides the client an opportunity to express their appreciation of the therapist. In 2017, a study conducted by Zolo, Padella, Pellegrini, and Seppi showed gift givers had internal satisfaction. This study also found that this interaction contributed to an individual that gave the gift as feeling more capable and caring for others. This is a social behavior that should be celebrated, especially when our demographic of clients often struggle with showing appreciation to others. The second point I would like to discuss is that gift giving is an encouraged practice for many cultures around the world, as it contributes to the relationship between staff and client. In a survey completed by Brown and Transgrud in 2008, it was found that after receiving a gift, only 8% of practitioners declined the gift. It seems more appropriate that we give up the guidelines for what type that we come up with, with guidelines for what type of gifting is acceptable instead of setting an unrealistic standard for the culture and society we are all members of. The third point I would like to discuss is how gift giving creates a gesture of kindness, which leads to a positive attitude between all parties. By not accepting gifts, a survey by Brown and Transgrud found often clients take that as the individual being cold, rigid, or distant, which can harm their working relationship and their practice. The fourth point Tiffany discussed, a small gesture can help both parties celebrate the client's success and milestones. Research conducted by Willingham and Boyle in 2011 found when a therapist received a gift when reaching milestones or finishing therapy, the therapist saw them as emphasizing the gains the client made. The therapist saw the gift giving as an expression of gratitude. Our fifth point describes how a small gift makes the therapist feel appreciated. The gift symbolizes the client's feeling of a job well done. Willingham and Boyle research found when receiving gifts from clients, the therapist felt positive emotions associated with the gift. Emotions included feeling flattered, humbled, and appreciated. The gifts symbolized that the client felt that they had performed a job well done. Our final point is how a gift giving can help build strong connections and maintain healthy boundaries between the client and the therapist. Brown and Transgrud found healthy boundary crossing actually helps build the connection between the provider and the patient. The stronger the connection, the more likely the clinical work will be successful. I'm now going to show the first half of a survey completed by Witt and his colleagues, which interviewed individuals asking if it was offensive to refuse a gift or offer. 44 of the participants out of the 57 said it would be offensive to refuse a gift. Now I'm going to hand it over to Stephanie on the con gift giving side.
Hi everyone, my name is Stephanie and I'm going to support the arguments made by Caitlin with the research we have found. Catherine, the survey table you showed also supports the first point made by Caitlin. The study in 2018 by Witz and colleagues found that multiple relationships are likely to develop as clients and BCBAs continue to have intimate contact with one another. In that same survey, when asked if accepting gifts from clients would alter their relationship, 44 out of the 57 participants indicated it would. The reasons it would alter the relationship included developing dual relationships, obligations to return the favor, feeling awkward to turn down a gift, and the possibility of starting down a slippery slope. To support the second point, an article by Arvid and colleagues discussed how gift giving can lead to blurred lines of professionalism. The article stated how it is essential to have clear professional boundaries for the safety of both the client and the patient to avoid any ethical violations. It went on to explain if boundaries are ignored, physicians can find themselves acting in their own best interest instead of the patient's best interest. The article by Arvid and colleagues also discussed the slippery slope concept that is often referred to. The slippery slope concept refers to a violation starting small that becomes incrementally problematic and the dyad starts slipping down the slope. This means perhaps you accept a $10 gift card this time, but what does it stop you from accepting a new flat screen TV the next time? The next thing you know, you're offering them a cheaper rate compared to other clients. Where do you draw that line once you start? The third point discussed was a change in power dynamic that can occur in gift-giving exchanges within therapy. The peer review article by Cottle and Hazelton discussed how receiving a gift from a client can present challenges when the practitioner or therapist needs to have a difficult conversation with the client. The power dynamic change can also cause damage to the rapport between the client and therapist, making it challenging to communicate with the client. This can cause difficulty in conversations that include medication, noncompliance, family dynamics, and also financial challenges. To support the final point made by Caitlin, gift giving can also result in a sense of obligation. The article by Grandi and Grant Kells stated that a therapist receiving the gift may not have an accurate understanding of the patient's motivation for giving the gift and feel obligated to reciprocate. This means that the therapist could then feel obligated to spend more time with that client, therefore taking time away from seeing other clients who did not give a gift. Furthermore, gift giving could also create favoritism, or the client could expect to receive some sort of special treatment because of the gift. The article by Cattle and Hazelton discussed how patients who give gifts may be doing so in order to gain higher quality of treatment and could become resentful if this did not occur. On a final note, Cattle and Hazelton advise if the therapist is unsure of the client's motivation, it might just be prudent not to accept the gift to maintain the boundaries of professionalism.
Hello, my name is Jacqueline and I am the pro attacker. I would like to thank Stephanie for the points that she made, but I do believe there are some weaknesses we need to consider with her arguments. Multiple relationships should be avoided as they can lead to harmful practice, but the act of giving or receiving gifts does not need to lead to altered relationships. Accepting gifts does not necessarily lead to blurred professional lines, nor does it mean that clients expect to get something in return. The American Medical Association, or AMA, creates ethical standards for other medical professionals. In medical practice, gifts are to be accepted with subjectivity. The AMA gives professionals the discretion to accept or deny gifts in their own practice. Teachers, another profession that is greatly admired, are not excluded from gift-giving behavior. When a teacher accepts a gift from their student, parents do not expect their child to receive better grades and do not expect the teacher to give something in return. This is an example where gift-giving does not directly change a relationship. Also, teachers and doctors are not seen as less professional because they participate in this gift-giving exchange. Similar to the AMA, the BACB ethics could create a more realistic standard and look at creating differential acceptance of gift-giving behavior. As a behavior analyst, your obligation is to your client. Because of this, the argument that receiving gifts from clients might make future conversations more difficult should not be considered. The majority of ethics outlined create importance of honesty and protection of our clients' well-being. With that in hand and in mind, behavior analysts should always be prepared to have the difficult conversations with their clients, as it is part of their responsibility, no matter where they fall along the lines of gift giving. There is no relationship that creates an exception to this rule that behavior analysts must always act with their clients' best interest in mind. Although Caitlin mentions that approximately 77% of professionals stated gift giving would alter their relationship, research shows a high percentage of professionals currently do participate in gift giving behavior. I'm going to share a graphic. Drawings from clients, pictures, and cards have more people accepting them than not. This paints a different picture for us to consider. As gifts increase in monetary value, the number of individuals who accept them does decrease, but this still shows that gift-giving behavior is happening within our field. This is where our side stresses that ethics need to consider a more realistic approach to what is appropriate or acceptable in gift-giving behavior.
My name is Mary Bewley, and I'm debating against gift giving for behavior analysts. I've noted some weaknesses pertaining to the argument that behavior analysts should accept gifts from their clients, and so I'd like to elaborate on some of those. One of the weaknesses that I noticed with Jacqueline's argument pertains to teachers, and I'd like to point out that teachers are not under the BACB guidelines. They do wonderful work, and they do work that is similar to the work that we do, but they're not held to that standard, and so that's a little bit of a different dynamic for them, a teacher teaching a classroom versus a behavior analyst in a practitioner role. We have different standards and different guidelines by which we need to abide. I would also like to point out that these boundaries and guidelines that have been listed within the Ethical and Compliance Code do not exist to keep us from connecting with our clients by any means. We are encouraged to build rapport with our clients and to pair ourselves with reinforcement. That's one of the primary components of ABA. And these guidelines are also not intended to offend our clients. The boundaries exist in order to keep practitioners safe from accusations or misunderstandings between clients and practitioners, which as humans, misunderstandings occur quite frequently, to be honest. So anything that we can do to prevent such misunderstandings should be promoted, especially in a field where we deal with people and parents so frequently. As professionals, it's essential that we adhere to these guidelines. We should not abandon the guidelines in order to appease the client. Abandonment of the guidelines for this purpose would be considered a slippery slope, as Stephanie mentioned in her argument, and it could easily become a serious ethical violation or a serious misunderstanding that could damage rapport with clients. The field of behavior analysis is an objective field, which consists of data collection and decisions that need to be based on such data. As a professional in this field, I would argue that we should avoid subjective matters such as gift exchanges, and we should really remain objective in our practitioner-client relationships. Pulling emotions into the relationship could be detrimental to the services that are provided by the practitioner. Additionally, practitioners should treat all clients equally. If gift exchanges are occurring between a practitioner and one family on their case loan, the practitioner will most likely show favoritism to that client, even if it's subconsciously. I don't think any practitioner would go out of their way to show favoritism to the client necessarily, but again, we know that as humans, sometimes we tend to act upon feelings that we're not even aware of sometimes. So again, avoiding this would be optimal for our profession. Favoritism could begin by spending slightly more time communicating with one family over another without even realizing it. However, it could spiral into providing better treatment for one client over another, which I think we could all agree is unethical and unacceptable. Which brings me to my next point, which also addresses positive feelings towards the client. As I stated previously, it's essential to build rapport with our clients and pair ourselves with reinforcement, and the potential for damaging our rapport through misunderstood gifts is pretty high in my opinion. Clients could give gifts with the expectation that they will receive something in return. Not all clients, but some clients might. If they don't receive anything, or if a reciprocated gift does not meet their expectations, they might become upset with the practitioner on a personal level. This scenario would damage the rapport between the client and practitioner. It also opens the door for the relationship to become personal rather than professional, which again leads us back to that slippery slope concept that we've talked about. I would recommend, and multiple sources have also recommended, presenting a statement that prohibits gift exchanges between therapists and clients at the onset of the client receiving services and at the onset of each therapist or technician or practitioner who is hired under a given behavior analyst. It would be beneficial to send reminder statements to the staff and clients around holidays such as Christmas, Hanukkah, Valentine's Day, a client's birthday, or even the end of the school year to help reinforce this policy. Disallowing gift giving is in the best interest of clients and practitioners alike.
Thank you, Mary. To recap, the Pro Group believes the BACB should consider revising the current absolutist gift-giving policy to a more realistic one, which would include the small gestures of kindness from the child or family. As Mary, the con-attacker just stated, we are professionals, and it is essential that we adhere to the guidelines and not abandon them in order to appease a client. The Pro Group agrees with that and understands the criticality of following the guidelines set before us. We aren't suggesting anyone break the ethical code of gift giving. We are merely trying to show how an independent, certified professional should be given the leniency to determine their own line between small gifts or gestures of kindness and larger gifts. According to an article from Witz et al., this corresponds to what is actually happening in the field, since 77% of behavior professionals believe it is rude to refuse a small gift or a gesture of kindness from a client or family. My pro-attacker, Jacqueline, stated the resemblance of our profession to that of teachers and doctors, who are greatly admired yet not excluded from the gift-giving behavior. This goes to show how professionals can accept small gifts from their students, clients, without directly affecting their relationship, nor does it make their career less professional. When small gifts or gestures of kindness are given to a teacher or doctor, parents do not expect their child to receive better grades or better health care, or even something in return for that matter. Our Pro Group share Mary's final thought, and that a memo sent from the company discouraging gift giving should be done. However, we still feel there should be some room left for common sense to prevail. Specifically, but not limited to, a center encouraging a Valentine's Day exchange, a family member offering a bottle of water or a cup of coffee to a thirsty therapist, a parent choosing to give holiday cards, or a client giving their therapist a hand-drawn picture, are all things that develop and nurture a relationship that may otherwise feel cold and distant due to the absolutist approach currently in place.
To summarize the points made by the con side, accepting gifts as a behavior analyst can have many harmful effects and is strictly forbidden by the BACB ethics codes because of these risks. By accepting gifts, multiple relationships can be formed that may lead to other guidelines being violated. It can create an unfair advantage for a particular client or family, making others have negative feelings towards a therapist or even the need to offer gifts as well. By allowing this to happen, the lines of professionalism may become blurred and can steer professionals away from practicing with the client's best interest in mind. The pro side brought up an idea of altering the code to allow for small gift exchanges to occur, but the term small to one person can have a completely different meaning to another person. This would also make things harder for our families to navigate what is okay and what isn't due to the subjectivity that would come from this. By simply advising against all gift exchanges, it leaves much less room for interpretation.
I'm now going to read and we will discuss some questions that were previously sent to us. First question is, what are some preventative strategies that we can use with, to help clients not offer to provide you with gifts?
So as I stated in my previous points, really my final point, and Tiffany agreed, I and other professionals would recommend that behavior analysts establish from the beginning what the ethics are and what is acceptable and not acceptable within the practice. The supervisor or supervising BCBA can proactively remind families around holiday times or other times that gift giving might occur that although they might want to extend their appreciation, that gifts are considered unethical by the BACB standards. It should be made known to the families that this is not a personal issue by any means, but rather it's a rule that the BACB requires apply to all clients who receive behavior analytics services. The behavior analyst could guide families to share kind words or even school pictures of the child, but companies could also suggest scripted responses for the ABA professionals to use if they're unexpectedly giving gifts and may not know what to say.
The next question is, what might be some adverse consequences that can occur if you accept a small gift, like a glass of water or a $5 gift card? And for example, what happens if a parent gives you a gift that you accept, but 6 months later decides that they're unhappy with the services you're providing and starts to seek out retribution?
So if a family decided they were no longer happy with services and wanted to take action, they could report you for the gifts no matter how small or harmless they may have seemed at the time. You could be reprimanded, fired, put on a suspension with your company as a result of this. The family could also demand that you return the gift to them. And let's say, for example, it was something like a $10 gift card. You may no longer have this in your possession, and you might not be able to return it to them, which could lead to an even greater issue.
The third and last question is, do you have any personal experience related to this topic that you would like to share?
Personally, I have found that where you work will really differentiate the level of expectations for acceptance of gifts. Currently, I live in Guam, where it is a cultural norm to show appreciation with food and participate in local fiestas. As an outsider servicing a community that I do not belong to, it is very culturally offensive if one does not accept things such as food when another person offers, especially if they are eating. I believe this is something that must be considered when looking at gift-giving behavior. Participating in a cultural norm or practice that is outside our own but shared among the population we are servicing can help bridge a gap of uncertainty when starting to build rapport with clients in our field.
Our clinic did a Valentine's Day exchange, and most of the kids brought small gifts for each other and all the therapists. I asked about these very small gestures, and the answer I received from several of the therapists was, "We aren't supposed to, but everyone does it."
I actually would like to share a personal experience too that I've recently had with a client wanting to send gifts to the therapist. So recently in our clinic, there was a parent who asked if she could give the clients gifts around Valentine's Day, and she was very unhappy when she learned that our clinic discouraged gifts and didn't allow gifts. And so as a result, she opted to give each of the therapists just a card that her daughter had signed. And so she was still able to give us the gesture that she was seeking to give us through a tangible gift, but it was in the form of just a card that her child signed. So it was somewhat of an in-between, I guess, where she didn't give us anything that was of monetary value. Rather, it was just a drawing from her child that just told the therapist that she was thankful for us and that she appreciated the work that we were doing with her child. And so we really appreciated this mother sort of working with us and finding that balance in just providing, not, like I said, not an extremely valuable monetary gift, but just a quick little card to say thank you.
Thank you for sharing that. In conclusion, the research we presented today supported both receiving and declining gifts from clients. Behavior analysts may benefit from training and cultural norms regarding accepting of gifts rather than refusing all gifts. The pro-gift giving side discussed how, on an individual basis, therapists should choose whether they want to accept a gift or not. It is very important for therapists to have boundaries with our clients. However, we also discussed how accepting gifts can create an unfair advantage for a particular client or family, making others feel have negative feelings towards the therapist or feel the need to offer more gifts as well. By allowing this, the line of professionalism may have become blurred and can steer professionals away from practicing with the client's best interest in mind. Thank you, Tiffany, Jacqueline, Caitlin, Stephanie, and Mary for all that you shared today. I hope everyone watching has enjoyed listening to our debate.